And these ladies who you see as active and fit, when they come and see you, do you feel they complain less about, say, for instance, back pain or kind of pregnancy related pain?
Yeah, I think yes, I think you're right there. I think they do kind of, yes, they have less. Oh, this hurts, that hurts, that type of thing.
Now,
Yeah.
what are the most common issues that you have seen over the years in your practice in pregnant women that you believe could be solved through the correct physical exercises?
So we get a lot of lower back pain because of the weight of the baby, and our postures are really poor.
Yeah.
We get a lot of SPD, and that's all. And your joints are loosened, and if the baby's in the wrong position, and that kind of disrupts the your pelvic base, and that can sort of really be a problem for pregnant ladies. Again, you've got a whole wide spectrum of that. Some days it'll hurt, some days it won't. Some women will need crutches, some won't need crutches. Okay. And of course, sleeping is a huge issue for these ladies because they just can't get comfortable, really. And actually, if they do get comfortable, then eventually that becomes sore, and then they have to move around, and that's all very, very sore as well. So it's just very, 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 very uncomfortable.
Yeah, you've actually touched on the next question that I wanted to ask about conditions that you feel would benefit from exercises. So you mentioned SPD, lower back pain.
You've got the bladder, sort of control as well. Some women who've had a lot, well, not a lot, maybe 1 or 2 children before, very often they will struggle with, a little bit of incontinence through the pregnancy as well.
Yeah, so I think that's one of the big things that most ladies miss is if it's your first pregnancy, great, you've still got nice, good pelvic control.
Yeah,
but when it gets to your second and third, it's almost like if you haven't focused on it and if you haven't put the time in it, you are going to lose it.
Yeah. And actually, they've got the problems afterwards as well. So not only have you got probably a few problems in pregnancy, you're going to get the problems afterwards, because actually after your first child, I always say nothing goes back after your second one.
Oh, I think from my opinion as well and personal experience that having the first child, I don't think I was as zoomed in on doing the exercises and making sure that I keep myself as fit as I did with the second one. And I think I felt so much better after the second one compared to the first one, just because of the fact that it was I was aware of the fact that I would need to be kind of focused on the pelvic floor. I think I was up and about much quicker than after the first one. I think the first one is a bit of a shock and you can't quite know, should I do it, should I not? But I think that was the advice actually you gave me is when I saw you for my last visit, is you said to me, just make sure you focus on your pelvic floor because your second baby is a lot kind of stretchy. Things give a little bit quicker. So just make sure you kind of pick up on that. So that was good advice.
I would encourage activity for someone who's got a breech baby, because actually it would help theoretically it should help with the rotation of the baby, actually, to be honest.
Yeah. And speaking from personal experience again, remember the bridge, so you basically you listened to a heartbeat right underneath my xiphoid, so right underneath my chest bone, and you just said to me, get moving, make sure that you move, and stand on all fours and things like that, and she did turn in the end. So yeah,
she did, didn't she? Yeah.